can you speak a little bit about all the really cool things that people can go get lymphatic drainage for that they may not know that they need to get it for, that how it can help?
Ooh,
Some really stuff.
that's a big list, my friend. Okay, so anything that has inflammation. So if you have sinus issues, you have eye inflammation, you've got nose inflammation, you've got gum inflammation, you've got skin inflammation, that's lymph. We can do a lot of stuff for that. So anything that has to do with an itis. So if you have a tendon that's, over repetitively and there's an itis at the end, that's inflammation. So that's lymphatics. If we look at, when we look at what your lymph moves, it moves a lot of hormones. And so it helps circulate hormones from your tissues back into your bloodstream. So that way, positive, negative feedback loops, whatever's needed. So if we're looking at any condition that's hormone related, that can be a huge impact when it comes to lymphatics. So I've worked a lot with fertility, infertility, dealing with starting labor and delivery, helping with nursing, breastfeeding, all those fun things. If we look at lymphatics and skin, okay, so any skin irritation, eczema, psoriasis, chronic acne, a lot of skin conditions we can help with lymphatics by helping clear away the wastes and toxins and so on that are found within the tissues. If I look at muscle health, if you're somebody who does a lot of exercise, your muscles are constantly sore, or you're doing exercise and you get the delayed onset muscle soreness. You're an athlete and you're feeling like, your one limb is just able to probably do two or three more sets, but the other one's feeling really tired. Lymphatic drainage helps move a lot of that lactic acid, the metabolic wastes that are found around your tissues. So it can be really great for athletes and recovery. I work a lot on special senses, so nose, eyes, ears, and mouth. So if you have any kind of irritation, vision issues, that kind of stuff, we can do lymphatics on your eyeball. There's a lot of lymph in your eye, just like there's lots of blood. Same thing in your mouth, your tongue, your trachea, your larynx. If you're a singer, if you're a speaker, if, I've worked with an opera singer, I've worked with a radio broadcaster, helping to clear up and make sure they had really good vocal strength for their day-to-day speaking events. I work a lot with people who have chronic tinnitus or vertigo, balance issues, and that has to do a lot with the middle ear. So you can do lymphatic work there. If we look at digestion, anything that's causing like inflammation, irritation to your digestive tract, lymph it. So if you have, gastritis, or if you're dealing with Crohn's, ulcerative colitis, leaky gut syndrome, you're dealing with small intestine bacterial overgrowth, we can do a lot of lymph work to help sort of clear away inflammation. So if you're starting a new diet or you're starting a new approach to treatment, it kind of cleans the slate. It kind of like helps remove some of the inflammation so you can start fresh, if you want to think of it that way. But all your organs have lymph. So if you have urinary incontinence, or you have kidney irritation, or you have adrenal fatigue, or you're having issues with, sugar balance within your body, like liver and adrenal glands and kidneys and urinary bladder. Like there's so many things. Like,
Yes, and the liver. Oh my gosh,
oh, I
right?
know, right? So it's not just like swollen ankles. Like there's so much you can do. I work with lungs for asthmatics and for people who have emphysema and post-COVID and who've had intubation. There's so much stuff you can do with lymph work, and it shouldn't be painful. Most of my patients should be able to sleep through it and snore through it, and they do, and they still get results. It doesn't deeper and stronger and more painful doesn't make it better.
No.
So,
In fact, one of my favorite words is the sympathicolytic effect.
yes.
Yeah, sympathicolytic effect. And that is, it's so soothing to the nervous system
Yeah.
that just the rhythm of doing lymphatic work calms the nervous system, makes a person just feel so drifty, dreamy,
Yeah.
and it's so pleasant to receive.
Yeah.
And
Well,
back, you were mentioning all the wonderful things that you can do with lymphatics. And those are all things that come in advanced lymphatic classes.
yeah. And
Yeah.
and if we look at like stress and, sleeping issues and anxiety and depression, all of those things, if we can even take it one step further and go into even more advanced lymph and talk about this beautiful glymphatics in your brain,
Yes,
which
we're both trained in glymphatics as well.
exactly. So think about how your brain functions, and if we don't move all that glymphatics and drain it every night, we feel foggy and we feel disoriented and we feel, unsettled. And so lymphatics can actually help drain the glymphatics of the brain. There's so many things. Seriously, this is why there's so much research on it. It's because you can find this stuff and it's there and there's research on it and you should go look it up because it's fun. I don't know.
And that's another thing, actually, that is a specialty that you and I are both trained in, the glymphatics, and also working with the ventricles, which are fluid-filled sacs in the middle of the brain. When someone has had surgery, that anesthesia loves to hang out in the ventricles, and that causes post-surgical brain fog. Or
Yeah.
if someone's had chemotherapy, they have the post-chemo or during chemo brain fog.
Yeah.
Of course, those chemicals do their job, but then when the job is done, it's time for those chemicals to move on out of the brain.
Yeah.
And
Flush it
so
out.
are specially trained to be able to feel that and help move that out of the brain and out of the body. And then the clear thinking can return. And that is just absolutely amazing.
Yeah. And that's the more training you do, it's not just skin. And that's kind of, I think, what the misunderstanding is too when I was in school and when I did, really basic courses, it was draining superficial, so the skin, right? Which is huge when it comes to appearances and puffiness, and there's a lot of great reasons for it. But when you start looking at you can drain the lymph and work with the lymph at every level. You have like, a bone bruise, that periosteum, that lining or covering around the bone has lymph,
Yes.
right? So we can work with organs, we can work with bones, you can drain a nerve because way I was taught how to treat sciatica back in school for massage, which honestly, when I look at it now compared to what I do now with lymphatics is it looks really brutal. And I remember just getting my patient to breathe through it. Just take some nice slow breaths. We can get through this. I'm almost done. If I'm draining your sciatic nerve, you're probably asleep and enjoying the dreams you're having because I can help facilitate and support that movement from the sciatic nerve, and it's not painful, and we get the same results. So
Right. And nerve drainage, again, is a very advanced
it
class.
is. Yeah,
It's not just simply draining the nerve.
it's
What we
not.
have learned is your brain makes cerebral spinal fluid that travels down your spinal column and then it flows out to all of the peripheral nerves.
Yes. Isn't that
So
crazy?
that's one flow.
Yes.
The lymphatics are the flow coming back. And then each nerve has three layers. It has an outer layer, a middle layer, an inner layer, and then the actual axon, which is conducting the electricity.
Yeah, it
And
has an axoplasmatic flow.
yes. And
Yes.
so we've been trained to feel the flow in each layer of the nerve
Yes.
and to be able to feel the difference between the cerebral spinal fluid flow and the difference between the lymphatic flow, feel where it's blocked and feel when it starts to flow again.
Yeah.
And that's Jedi school.
But it isn't. And then the science behind like that's the thing, right? Like if somebody's just like, "Hey, let's just like throw this idea out there. I think it'd be really cool." And then there was nothing to back it. I'd sit there and I go, "So?" But there's science. Like it's not just somebody, in a sort of psychedelic high creating this idea. There's science behind it. And,
Yes.
even just personal, like I've seen the difference. I've had patients who have seen the difference, and they normally don't realize I'm doing it because they're asleep. But then when they wake up, they're like, where's the nerve pain? Where did it go? So again, it's understanding, it's doing a deep dive into the studies that you want to do that you're passionate about, and then treating within the scope of your practice, within the scope of your trainings, and understanding when something is beyond. And that's the hard part. We all, everybody's trying to make a living, everybody's trying to help as many people as possible, but there is a difference. You need to stay within the scope of what your training taught you. So, that's the big difference I find as well, is people who, learn lymphatic work for like half a day in school and now are like, no, no, I can work with lymphedema. You might get a phone call from me and we're going to have a really big conversation because you can cause more harm than good. And so there's that ability of recognizing when something's beyond you, just recognize, love, refer that person to somebody who has the right training. They'll come back to you because you cared about their wellness first. And that's how it should be. But that's me and my cute little soapbox way up here in Canada. So,
Absolutely. Um, I have what is called a precise private practice.
hmm
So I only take clients that I can help
hmm
and with whom we have a good rapport with each other,
yeah,
because that is very important to the therapeutic relationship.
you'll get the
Uh,
best results.
you'll get the best results.
Yep.
That's what I focus in on, is results driven therapy.
Yeah.
And that's what people pay us for. They pay us for results.
Yeah. And that's the therapeutic component, right? There's a relaxation industry, and that's very different. And then there's the therapeutic industry, which is different. So recognizing where you fit and what you can, quote, claim to do, know your limits and know what you're gonna put out there and what you can do, and just, you'll get better results overall.